Okay, I will go ahead. So thank you so much for the introduction. I'm going to share my slide again. It's great to be here. Sorry, I'm joining you online. I wish I can be in Mogadishu today with all of you. Congratulations to you all, to the One Health Somali One Health Center, led by Abrar University, particularly Chancellor Dr. Ahmed Kadel and all the team members. We've met with Ahmed back in 2017 when we did International Congress on Pathogens Human-Animal Interface in Doha, Qatar. Since then, it's been really fantastic progress in Somalia. We need One Health all around the world, as it has been said already by the former speakers. I was able to hear very well Dr. Marina from WHO, so it's really great to be here. Thank you so much, but with my regrets that I missed to be with all of you in Mogadishu. So the topic today I was asked to cover is in terms of One Health curriculum, integrating One Health curriculum to really produce the next generation of professionals who are savvy in One Health. So I will do that in the next 20-25 minutes and have a chance to discuss. Briefly, Ohio State Global One Health Initiative. Our vision is to really produce healthy and enduring global communities. And the question came up on capacity building. And as a university-based organization, we would like to achieve that through producing capable professionals and capable institutional systems. To achieve that, our strategy has three major goals. Oh, sorry, going back. One large portfolio we do is applied research and implementation capacity. We do quite a bit in East Africa and other regions in Brazil, previously in Southeast Asia and others. The other is what we cover today. You see in the center of it is a training and education capacity building, which is also integrated with research partly. And the third is outreach and education. I will be focusing on the central part of our strategy today. So just to give you a broader context of Global One Health Initiative, and as it has just been said by Dr. Marina Modeo, there are broader contexts of One Health than what we traditionally call One Health, such as zoonotic diseases or food safety or foodborne and others. Considering where our planet is today, post-pandemic, and hopefully to prevent a future pandemic, we need to have a holistic view of the One Health approach. This image, as well as the definition, is from the United Nations One Health expert panel, but it really speaks volumes in terms of what we all need to do. What you see in red, the upstream part, is the traditional One Health, looking at various aspects of human, animal, plants interconnectivity. But often there will be a zoonotic spillover to humans, and the emphasis for One Health is anyway on prevention, preparedness, and response against public health hazards, including VPDs, vaccine preventable diseases that were mentioned. It could be a measles, or it could be polio to some extent in some countries, or it could be laboratory capacity building. How do we build a resilient system? And it could be workforce. How do we build the future professionals very well trained to tackle complex One Health issues? Okay, so I'll focus on that part today, on the One Health component. And this shows you, that preparedness, the prevention, detection, response aspects, and using our capacity building, capacity strengthening model. The world is facing various pressures from zoonotic spillover, climate change, the world population is growing, there are huge risks of biosecurity, biodefense, biosafety. That leads to major global health challenges. One of the global public health crises, for example, is antimicrobial resistance, just mentioned earlier, or increase in non-communicable diseases, including cancer, or foodborne, waterborne, vector-borne diseases that we know traditionally. So how do we respond to that? Is strengthening capacity. And workforce training, One Health curriculum is part of that capacity strengthening. And it needs to be in an integrated way, addressing grassroots complex challenges and also shaping the future professionals in terms of leadership, meta leadership, leaders that can tackle complex issues, leaders that can work across administrative boundaries, leaders that can work across discipline boundaries. That's meta leadership. Today, we don't have time to cover on those, but maybe in the future, we'll cover on those areas as well. So the need for Global One Health, to summarize my introduction, is, the partnership is critical part, as it's been highlighted by COVID-19. It's really the capacity of the whole world, including the United States of America, has been way behind to really be resilient and tackle a pandemic efficiently. So it's a global problem to all of us, not just to low to middle income countries. And the One Health approach for sure gained lots of momentum because we learned from COVID-19 that disciplines that were traditional or unconventional in the One Health realm are also important. You all know the disruption of supply chain because of the pandemic. That's a business issue, but very important, One Health issue, and among many other areas. So training, curriculum, building capacity in an interdisciplinary or transdisciplinary approach is currently limited, but needs to be accelerated. So I commend Somalia, what you are doing, and really to the region as well as to the world. Okay. So quickly, our integrated strategy, what you see on blue here is a training and education capacity. How are we trying to achieve our vision that I shared with you? Typically, in any country we work with, we do needs assessment. We have short-term, mid-term, long-term, like Summer Institute is modular course short-term. We had quite a few Somalian participants before. Curriculum twinning. We just wrapped up one major project in Ethiopia with colleagues from Columbus, Ohio, are in Ethiopia currently over this weekend, wrapping up veterinary curriculum twinning. PhD, postdoc program sandwich, that's to build sustainable long-term capacity building. When we do this, I will share with you more, then critical mass of trained professionals that can do One Health can be built, workforce can be built. I will focus today just on that, but we also do various applied research implementation capacity. I don't cover today. We do outreach and extension or engagement capacity. We also do resource stewardship, different supportive things, visiting scholarships. We had more than 100 or 120 or so from East Africa to Ohio State, and many of our scholars, students, professors are on the ground in East Africa constantly and learning from you and learning from each other and strengthening partnership, all that. And when we do that, that's when we achieve our vision of capable professionals and institutional systems. But today, I will quickly focus on the blue side, giving you some examples. Examples of a short-term curriculum building in One Health, medium-term and long-term. Okay. So the Global One Health Summer Institute is something we have been doing in partnership with originally Ethiopia, Kenya, Tanzania. Then as we move on to virtual format, broader Sub-Saharan Africa, as well as Brazil, Latin America, Southeast Asia, United States, and some European partners are also are taking part. This program started in 2012, and really it's augmenting, supporting your existing curriculum. And I encourage you, this has been going on for a long time. I call upon, Abrar University is a very active one, but even other Somalian institutions, including your Ministry of Health professionals, to take part. Happy to share information as any time with you, to Chancellor Ahmed or all of you. So 2023, this past cycle was the 12th anniversary for our Summer Institute. It started really in Addis Ababa University, University of Gondar, and Ohio State, but now very large participants. From Kenya example, we've got a good liaison office at Cambridge, Kenya Medical Research Institute, and University of Nairobi, but a large, broader participation. So over the years, 2012 was very few, I think 4 or 5 modular courses, 13 it accelerated. Since then, it's going very strong. So if I give you example of 2023, 29 courses were offered, and these course suggestions come from you. Somalia or Abrar University can suggest we need capacity in this area. We, Ohio State, identify that based on your need, professionals, professors. If not Ohio State, we have a large, great partners from the US, Europe, others that who can teach the course, or Latin America, others. This 2023, we had close to 2,700 trainees, mostly early career professionals from 56 countries, and we engaged about 96 faculty members, staff, coordinators, moderators in the process. So this is just 2023. Over the years, 2012 now, and there's a large, I mean, you can see the PDF on our website as well, large number of relevant courses, again, to support your curriculum. This is a short-term plan, so it's supporting your curriculum. Molecular epidemiology is one of the first one, which I myself have been teaching for a long time, and others are teaching it now. Food safety, data analytics, ethics, equine medicine, or human internal medicine series. And many grant proposal development, that's something I and a number of others teach as well every year. How do you mobilize resources? How do you garner extramural funding for your research and things like that? Many, many others. So overall, since 2012, we taught more than 8,600 trainees, close to 450 faculty, member staff, academic staff involved, and 75 countries plus the 2023 in different countries. So every year there are some countries are overrepresented. Ethiopia is, I could say, overrepresented. Lots of trainees come from Ethiopia or East Africa in general, but a lot diverse. We are now truly a global One Health Summer Institute. I'm proud to say that. Okay, that's a short term. So how do you build capacity building? Is not we, the United States or WHO or somebody from Europe coming and teaching Africa or Northeast Brazil, others. Always, that's not capacity building. But how do we build together your capacity in the local context so that you can take it over and you no longer need us. When you don't need us from the United States side, that's our success. So our journey, the next step beyond Summer Institute is twinning program. Here is an excellent example, one in a kind in Africa. The really the first one. OIE is no longer OIE, as you know. It is World Organization for Animal Health, harmonized veterinary curriculum. It's between the University of Gondar in Ethiopia and Ohio State University. Dr. Armando Hoyt, as we speak, is in Ethiopia. Wrapping up this project is something wonderful that I highly recommend to the Somalis. It doesn't need to be veterinary, by the way. It can be a public health curriculum. It could be a pharmacy curriculum. It could be integrated health science curriculum, but it requires significant amount of funding or resources, of course. So this is a PVS pathway, as many of you know, is really veterinary education curriculum project from World Organization for Animal Health. University of Gondar and Ohio State started this in 2015. I will quickly go through that. The twinning objective, strengthen Ethiopia's veterinary service. The veterinary, it's not about the university, remember. It is a cattle herders, a pastoralists, agrarian committees. How do we build capable professionals that can address veterinary services in the country and in the region? The same is true for Somalia or Kenya or Sudan and beyond. How do we build competencies? How do we develop a uniform assessment to identify training gaps and so on? This is a model system for Africa. Remember, this is the first one OIE funded starting from 2015, now with supported through the Gates Foundation funding. How do we increase the number of competent, newly trained? Day one means it is the day you graduate. Are you fulfilling the global needs so that you are capable, your institution is capable, trained veterinarians? How do we provide continuing education and professional development opportunities for those already in the field? I worked myself as a veterinarian in Borana, Ethiopia, highly agro-pastoralist community in South Ethiopia that borders with Kenya, borders with Somalia, of course. I know that's a long time ago, more than, about 30 years ago now. So our curriculum assessment development, I'm not going to go into detail, but there is assessment, there is a curriculum development phase, there is implementation and evaluation phase. That's the first one, first task of the project. So there are various activities that has been happening over the years and lots of knowledge gained. Even though, by the way, the Ethiopian host university is Gondar, and the second phase is expanding that to the Ethiopian, I think 12. Right now, Ethiopia, I believe, is got 15 to a bit too many veterinary schools, but also, having the different other colleges and faculty of veterinary medicine. So I think 12 of them are actively participating. And this model, by the way, now is being adopted in 3 countries in Southeast Asia, if I'm not mistaken. Definitely Cambodia, Philippines, and 1 more country. But this is a global need, building your capacity, your institutional system. Here is an example of the activities, assessing transboundary animal disease competency of the faculty members at the different veterinary colleges. University of Gondar is the host, but 12 of the Ethiopian veterinary colleges. Are they highly capable of competent or moderately competent? There's been different assessments, workshops, many activities, manuals, products developed out of this project. But to wrap up this is the first OIE harmonized one in veterinary curriculum. The goal is to replicate it in different countries beyond Ethiopia. I know there has been our project leader professors and the Gates Foundation were discussing to expand this to Kenya, but again, I think, it needs to be expanded, the model, adopting it to different countries, including Somalia, to make the institutional system strong and resilient to prevent, to detect and respond future epidemics as well as potential pandemics. Okay, then what do we do as a longer term is, besides curriculum twinning, producing those professors on the ground, what you have in countries or in the region, to be, who would be, okay, you strengthen curriculum, who's going to teach those courses in high quality manner? Do you have enough capable professors? We do it in a long-term training and educational capacity platform using master's, PhD, and postdoc. One example, one of the recently NIH-funded project is a master's program in One Health Ethics, One Health and Emergency Research Ethics, in short, MOHER. Dr. Donald Matuna and Dr. Andrea Ruda from our College of Nursing and College of Veterinary Medicine are leading this effort, and many from the University of Nairobi, Upper Kabete, in the College of Veterinary Medicine, Agricultural Sciences are also involved. So a number of Kenyan master's students are admitted. This curriculum is one in a kind, global. We don't have one as ethics even in Ohio, but we have the professionals who do ethics. So bringing the professionals together, established this program at the University of Nairobi, approved by their Senate, curriculum approved. Now, 6 Kenyan professionals are funded by the project, NIH R25 project. In addition, 16 Kenyan students or early career faculty from the University of Nairobi are admitted. So there's a large number of first-year graduate students. So the goal is long-term capacity building. One more example is our NIH D43, One Health East Africa Research Training, OHART. You see the acronym here. It's a sandwich PhD postdoc program that has been running since 2010 through 2024, and we are now hoping that will be extended for another 5 years up until 2029. It's NIH funded. We trained 28 PhD fellows graduated. These are from Kenya, Ethiopia, and Tanzania. Fairly more than half are from Ethiopia, some from Kenya, and I think 2 or 3 from Tanzania. We also don't just train the PhD level, those will be professors in teaching, but these are research professors as well as teaching, research training. Therefore, we train laboratory technologists. 46 lab technologists are trained, and various products out of that. And they are tackling many issues. As you can see, for example, the camels you see in the middle image is working. One of the fellows at the time was working on Middle Eastern respiratory syndrome, MERS virus, which is very important regionally, Horn of Africa, as well as Saudi Arabia, where you export camels to Saudi Arabia, to my understanding, or Djibouti, Ethiopia, Somalia, Kenya export camels. So MERS virus, or tackling foodborne, waterborne, vector-borne diseases, antimicrobial resistance. We're not just training, but we're also doing grassroots impact in terms of research. So we do lots of these other implementation projects together with the US CDC, together with WHO, definitely together with the leadership of the countries like the Ethiopian Public Health Institute. There are many things we do in terms of workshop-based, others to the Ministry of Health. It could be on vaccine preventable diseases, or AEFI, adverse events after immunization, or it could be in many different areas. We recently built laboratory capacity in Ethiopia. We added 4 molecular diagnostic laboratories to Ethiopia. Ethiopia is a large country, as you know, 120 million people, but had only 1 molecular diagnostic lab in Addis Ababa, but we added 4 molecular diagnostic labs. Those will be staffed and needs to be staffed by the professionals that are graduating from the universities, right? So Abrar University graduates will go to serve Somalia, and maybe beyond, even in the region. That is the wish. So we need to have integrated way. We don't just train, but a complete package. We build laboratory capacity, we build surveillance capacity, we build workforce capacity. Together, it will strengthen the healthcare system of the country. So any country we partner with. But today we're focusing on workforce. Okay. In summary, integrated One Health curriculum is critical to the sustainability survival of our planet. It's being recognized very well. Pandemic fund was mentioned earlier. Many countries got funding, including Ethiopia, which is very good to many countries. So building capacity through that is very important. When we build capacity, we have to have this transdisciplinary mindset. We have to be, if I were in the room, I would have asked how many of you have a veterinary background or professionals, public health, social science, business, engineering, but often we are very much siloed in the world. In the United States or Europe, or same thing is many places. We need to change our mindset into transdisciplinary way of thinking to address complex issues of the world. We need to have a long-term vision and yet achieve in a short term in a nimble way is what I advise is important. Partnership is crucial. You scientists are, you and I, all of us in the scientific world are crucial to create such partnership, particularly for Sub-Saharan Africa, in such complex world we live in, where One Health is needed, where the pastorals, others move between, or merchants or others move between countries, Somalia, Ethiopia, Kenya, Somalia, Kenya, or Sudan, Djibouti, others. We need to strengthen partnership, institutional, to address grassroots problems. That is critical. And I wish for Ethiopia and Somalia to resolve the politicians, resolve their differences in a very good, peaceful, productive way. Our communities, our farmers, agrarian pastoral communities need that. We need to work efficiently at the universities level, but we need to have a very good environment that serves everyone's purpose in an effective way. Use of technology is critical, and that accelerates our efficient implementation. Every day, the planet receives more than 375,000 babies, according to the United Nations. Every day, and a kind of an island full of babies are added to this planet. To tackle that, we need to have a very efficient way, and technology helps us in that regard. So I can say a lot, but for today, I will stop there. Here is where we are as Ohio State Global One Health Initiative. We focus on low to middle income countries, mostly in Latin America, Sub-Saharan Africa, different projects we have in South Asia as well as Southeast Asia. But looking forward to be on the ground in Mogadishu next time. And thank you so much for your attention. Shukran.